Nyaboke is my guest tonight. Drusilla, there's something you were unpacking for us before we get to the concerns that come across or that comes around or that come aboard as to, reduced donor funding.
Yeah, so saying we have latent TB and active TB. So when someone is exposed to the bacilli, so the bacilli is this germ that causes TB disease. Yeah, so when they're exposed to that bacilli, you can either inhale it, and depending on your immune system, sometimes the body is able to fight and get to encapsulate that bacilli within the body. So in that case where you have not exhibited any signs and symptoms, that is where we say you have latent TB.
Okay.
And when you exhibit the signs and symptoms, which in this case maybe we have 4 cardinal signs and symptoms, which is coughing, drenching night sweats, fever, unintentional weight loss. Sometimes we have people who want to lose weight, but unintentional weight loss. And for children, we look at failure to thrive and lethargy, including, history, whether there's a history of any contact with a TB patient. Yeah, so when you have that bacilli within your body and you have not yet exhibited signs and symptoms, that's what we call latent TB. And when you then exhibit the signs and symptoms, that is when you have the active TB disease.
Oh, all right. So yes, as Alia mentioned, we have seen that there's a huge impact. This is due to the reduced donor funding on diagnostics. We can't forget, of course, treatment and community level services. How is the situation like?
Yeah, diagnostics is key. As mentioned earlier, we need to find all these people who have the signs and symptoms, ensure they are tested, investigated, and those found with TB disease put on treatment. And as a country, we are advocating for active case finding.
Yeah.
Active case finding is all those patients who come to the hospital, irrespective of their presenting symptoms, should actually be screened for TB. It takes a minute or two to just ask the four screening questions that I mentioned earlier, such that then anyone who's found to be having any of the signs and symptoms can be rerouted appropriately. Further, as a country, we are large on digital chest X-ray, AI-powered digital chest X-ray, which will be able to actually improve and on screening aspect. Because now when we are able to have the chest X-ray done on these patients, and AI-powered, then there's a score that is obtained, and that score it correlates with the clinical symptoms, know who's supposed to go to the lab, and it helps make diagnosis easier. So as a country, we are focusing on, the digital AI-powered digital chest X-ray, increasing the coverage. Recently, we had 80 machines that were launched and distributed to counties. In terms of also targeted outreaches, because sometimes we need to find those pockets within the community, those who don't come to the hospital, and this is where actors like the community health promoters are vital, because they stay in the households with these people, with these Kenyans, so they are able to know at an early who has the signs and symptoms, who's coughing, and be able to have timely intervention. So within the communities, we also do the targeted outreaches, whereby targeted in that to go to high-risk areas, we can do hotspot mapping, where we look at the data that is reported in that facility and single out a village or an area that has a higher than normal incidence of TB and target the outreach there. We can also go to the specific and vulnerable populations like the prisons, the prisoners. So we have those targeted outreaches that the community component is really key. And from there, then they can come to the hospital and be reviewed by the clinician.
And I take it that some of these things that you have mentioned are critical, and they speak to the question of sustainability. Just how possible, especially now that we talk about reduced donor funding, still on that matter?
It is important. As a country, we are leveraging on, we are advocating for universal health coverage. So in universal health coverage is ensuring that TB is also covered. As the patient go to this hospital, they can be able to access all this care that is required within the hospital. So leveraging on ensuring that universal health coverage, the package of care covers TB, and every facility that every Kenyan is able to access should be able to access TB services, right from screening, diagnosis, and treatment, will help mitigate some of the impact with the reduced donor funding.
And this is actually what essentially should be.
Absolutely.
But the question is, there have been a lot of concerns as to, the funding of the healthcare sector. And some would say that, yes, there's a huge chunk of amounts that are sent to the healthcare sector, but they still, fall short of addressing some of the key concerns. So if we're going to talk about this, do you suppose that we have set, the plans that have been set domestic, at that level of the domestic level, do you think we have proper plans as well as strategies to ensure that we have, resource mobilization that is critical and that is good enough to ensure that we have long-term financing elements that are strong enough to keep us afloat despite this reduction of funding? I
believe the tenants, the foundation is there. We just need to build on this foundation. Like currently, there's allocation for first-line medication. We have quite a big chunk that is bought by the government. So we need to sustain on that goodwill and look at how best can we be able to ensure within the broader health infrastructure, get to ensure that we have TB incorporated in there. Look at, for example, in the health facilities, the staff that we have there. The staff is, majority of the staff are actually by the government. So, and this staff should be able to, handle all the diseases in totality. Of course, in some areas we had staff who were donor funded, but with time, with integration, then we are having other staff who are there, slowly taking that up. So it's not something that will happen one-off, but I believe the goodwill is there. And with continued advocacy, we have seen a lot of advocacy from the civil society, organizations, the TB champion. So with increased advocacy, then there'll be able to be increased allocation. It has to be gradual, it may not be one-off, but I believe the goodwill is there and there's the machinery to be able to progressively see how best this can be taken up through universal health coverage, through leveraging the existing community health promoters, seeing how best they can be able to get to the community. Right now, as mentioned earlier, we have the digital AI-powered chest X-ray that will be able to improve on the diagnosis. And a key area is multi-sectoral engagement. You saw now for like children, being able to target other sectors other than the Ministry of Health so that we can be able to leverage. I mentioned earlier about ventilation and aeration. So the Ministry of Housing, if during house construction, some of these can be put into consideration, ensuring there's enough ventilation in those houses. Like right now we are thinking about, the conversation about housing. So it's important that all sectors pull together. The Ministry of Education, the children, like Jaden, who are within schools. So if Jaden is in school, we need to ensure that the other students are screened, so that we are able to ensure they are screened and appropriate management is given. So it calls for a multi-sectoral approach. The private sector. Jaden's mom mentioned about going to Coptic Hospital. So the private sector is also a key player, because we know quite 42% of the Kenyans seek care, the first initial care, within the private facilities. So just ensuring all these sectors are on board. All
right, and we go back to the story, Gasping for Breath. They highlight numbers and data on the progress that we have made as a nation. What do you suppose are some of the measures that need to be taken to ensure that we safeguard this process, that we have made towards TB control in the country?
Thank you very much, Linda. Indeed, we have made commendable progress towards TB control in the country, and it's important that we have all stakeholders on board. It's important that the voice goes to everyone, to every Kenyan, starting with Kenyans, to just get to know what TB is, what are the signs and symptoms, what should they do, should they be having any of the signs and symptoms, and so that they can be able to visit the facilities. And within these facilities, countrywide, we have about 700 diagnostic technologies. We talk about GeneXpert. GeneXpert is a more sensitive diagnostic technology that is able to detect TB as compared to microscopy. Microscopy still does, but the sensitivity is lower. So ensuring that these facilities where the Kenyans are able to access at first visit, they're able to get these services. So we have 700 across countrywide, but that is still lower, considering that we have 13,000 health facilities in Kenya. So you can imagine 700. We still have a long way to go, though we have made progress. This is not where we were a couple of years ago. Secondly, once Kenyans know and there's access, they're able to access, then within these facilities, if they are put on treatment, once the diagnosis is made and they're put on treatment,
right,
we need them to adhere to their treatment. We need them to ensure that they're taking medication as required so that we cut the transmission tap. Yeah, so gains are there, but we need everyone. We need stakeholders on board. We need to ensure if it's the ministry, other ministries, other sectors are also on board so that we do not erode the gains so far gained.
And I know that throughout the interview we've mentioned some of the innovations that are being employed so that we can manage or control or address TB concerns generally. Do you suppose that, or maybe do you know of any policy shifts or partnerships that the government is exploring that is to ensure that they strengthen TB services in the country, and perhaps just in the future, what it is that they have in terms of all this?
So in terms of policy, we currently have the National TB Strategic Plan that is running from 2023-24 to 2027-28. Okay. And in this National Strategic Plan, which is very bold and outlines key milestones that we aim to get as a country, to achieve as a country. And in there, we look at key pillars. One of them being diagnostics that you already mentioned, so ensuring that diagnostic services reach closer to the people, including the AI-powered digital chest X-ray. That is an innovation that we are looking at. Private sector. We have quite a number of facilities that are private sector, and we have to ensure that they are a key partner. Look at the chemist, look at when a Kenyan is ill, they'll most likely visit a chemist to go and just get over-the-counter medication. So when this person at the chemist, when this person at the pharmacy is empowered to think if a patient presents with any of these key signs and symptoms. So we have a policy around active case finding, ensuring that, whenever they visit the facility, they're screened for TB and they are referred to the hospital for appropriate treatment. And there's also another guidance around using GeneXpert as the first test for testing in facilities where it is available. That is also a guidance using GeneXpert as the first test for diagnosis. We have a policy around TB preventive therapy that I talked about earlier. So all this augments the efforts and the strategies within the National Strategic Plan so that to ensure that we get to we end TB by 2035.
I can only hope as we come to a close that there's a lot of awareness that is being done, because we still have cases of stigma.
Absolutely.
We still have cases where people, have signs and symptoms, but they do not know where to go to. Like you rightfully say, they will run to, the chemist, and perhaps there's late detection of all this. Just how much awareness is being driven out here.
Yeah, and thanks for mentioning that, Linda, because stigma is still rife. And I'll tell you for free that sometimes you can find once a Kenyan gets TB, they shy away from visiting the facility that is closer to their home, so that their people, their neighbors and their friends do not know, and they go far away. So stigma, and the only way to break that is to ensure we create awareness. The same way we had Giuliani, the social media, it creates awareness and ensure that we demystify all the myths around TB. Yeah, we've heard that other myths, people say that if you have TB, you have HIV. That's a lie. Only 25% of TB patients are co-infected with HIV. So we need to ensure information goes out there to as many Kenyans as possible to just get to know TB is not a death sentence. TB is a disease like any other. It is treatable, it is curable, and above all, it is preventable. We just need to ensure this information goes out there and everyone becomes a TB ambassador in whichever space, whichever office they sit in. Of course, with this, then resources are required. So wherever they are, whether even in the corporate sector, there are a lot they can do in terms of branding for TB, in terms of ensuring that even as people wait online, within the Fortella services, we have TB messages that are running. So awareness is key to just get to ensure everyone is board in this.
I think as we have this conversation, this is what is ringing in my mind, that TB in a tiba, every time. So people must know that. Thank you so much, Drusilla Nyaboke, an epidemiologist with the National Leprosy, Tuberculosis and Lung Disease Program right here in the country. Asante sana for the great insights. And of course, from that particular story, I hope you can pick a lesson or two and, do not sit at home especially when you have all these signs and symptoms. These help out there. Yes, we also are being told that we have late